Now we're moving to the next stuff here. And the next stuff is what is known as the pathogenesis of esophageal varices. So pathogenesis of esophageal varices, you are just looking at step by step to how did a disease condition actually come to be. So first of all, this is esophageal varices. Alright, so step by step to how esophageal varices actually came to be. So for this thing, esophageal varices, looking at the step by step to how it came to be. So first of all, you should know that what is usually associated with liver cirrhosis, and you have a lot of tortuous veins around the lower side of the esophagus most at times. So this is because blood is now diverted into collateral veins at the gastroesophageal junction, mostly because the liver is resisting blood flow. So pathogenesis of esophageal varices, first of all, there's portal hypertension. So if there's increased resistance in the liver, okay, or say the portal venous system, usually because of liver cirrhosis, that's fibrosis and nodular regeneration, so it will lead to elevated portal venous pressure. So collateral circulation formation is body attempts to now bypass the high pressure portal system by opening collateral channels between the portal and the systemic veins. So now blood will now be flowing into other veins like the gastroesophageal junction. It could be the rectum. So if it occurs in the rectum, that's around the anus, it will cause hemorrhage. If it occurs around the umbilicus, it will cause the caput medusae. Okay, so esophageal varices development now. So at the lower third of the esophagus, submucosal veins connect the left gastric vein with azygos vein. So with persistent portal hypertension, the veins will actually dilate. Okay, so structural weakening is variceal walls will keep becoming thin and fragile, okay, because the pressure is actually increasing and there's mechanical stress leading to high risks of rupture. So morphology now, so gross, there's tortuous dilated veins in the distal esophagus. On endoscopy, there's prominent bluish mucosal veins, sometimes with what? Cherry red spots, indicating high bleeding risk. Alright, then clinical consequences, there's massive upper GI tract bleeding, then hypovolemic shock if bleeding is severe, then high mortality. Okay, it could be bleeding tendencies. Alright, then even after treatment, risk of bleeding still remains high.